Trauma affects all human beings' physical, emotional, behavioral, cognitive, spiritual, and sensory reactions. Adults and children are affected by trauma in ways that are both similar and different. It is important to understand that these reactions are usually common and normal under the circumstances. The next set of images will cover many, but not all, of the common ways people react to the trauma of a disaster or crisis event. Common physical reactions in adults may include difficulty sleeping, gastrointestinal problems, stomach upset and nausea, muscle pain and tension, and sweaty palms or a racing heartbeat, elevation in the levels of blood pressure and/or blood sugar. When the stress continues for an extended period of time, the normal functioning of the immune system may be suppressed, making a person more vulnerable to illness. If a person is experiencing severe physical reactions, they should check with a medical doctor to rule out any physical causes. Common physical reactions in children may include headaches, stomach aches, nausea, eating problems such as being unable to eat, speech difficulties such as stuttering, and skin eruptions. You may find that children are more apt to discuss their stress in terms of physical pain. So remember to consider stress as the source once you have determined that there is not physical illness or injury causing their pain. Common emotional reactions in adults include feelings of fear and anxiety, sadness, or depression. They may display anger and irritability without even realizing that they are coming across as angry. Adults under stress may feel numb, withdrawn, or disconnected from others. They may lose the desire to be involved in social events or to enjoy previously enjoyable activities. They may also experience a sense of emptiness or hopelessness. If any of these reactions interfere with daily functioning or quality of life, you should recommend seeking the assistance of a behavioral health professional. Common emotional reactions in children might be feelings of anxiety and vulnerability. Children may be afraid that the traumatic event will recur. They might be fearful that they will be left alone, especially if the incident involved a separation from family members. Children may feel unsafe, even after being removed from unsafe circumstances. They may feel depressed, angry, or even guilty, as if somehow they are responsible for what happened. It is important to talk to children at their developmental level to determine what they are thinking so that any misunderstanding can be resolved. Common behavioral problems in adults include an increase in family difficulties and interpersonal conflicts. Sometimes adults may become hyper-alert and easily startled. Some people may become overprotective of their family members in an attempt to shield them from additional danger. Others may try to avoid their feelings by keeping excessively busy so they can delay dealing with their problems. They may isolate themselves from others and avoid people, places, and activities that remind them of the event and their feelings. Adults may try to cope by abusing alcohol or drugs, gambling, compulsive eating, or shopping. Unfortunately, the best time to develop a new bad habit is during a time of extreme stress. Common behavioral reactions in children may include developmental backsliding to childish or regressive behaviors, such as thumb-sucking or clinging to a parent. These behaviors are probably not deliberate misbehaviors, but the result of the child's increased sense of vulnerability. Children, like adults, may also develop problems at bedtime, such as being unable to fall asleep, waking during the night, being newly afraid of the dark, and fearful of the event recurring during the night. Common cognitive reactions in adults may include difficulty concentrating or remembering things. It may be difficult to communicate with others. It may also be hard to follow complicated instructions. They may have intrusive memories of the traumatic event, recurring dreams, or even nightmares. Flashbacks, where the person feels like they are reliving a past traumatic event by actually re-experiencing past sights, sounds, and feelings, can also occur. Common cognitive reactions in children include confusion, memory loss, and disorientation. Difficulty concentrating may result in behavioral problems in the classroom. Some children may function at their best in school, where they have continuity of structure, a sense of control, and a familiar peer group to rely on. While children may need some extra attention and comfort during a crisis or disaster situation, they also need to have a familiar structure and daily routines. Both adults and children may react spiritually to trauma by developing increased reliance on their faith beliefs. Alternately, some people might begin to question their values, believe that life has lost purpose or meaning, or blame an unfeeling higher power for their misfortune. Some may discover newfound comfort in faith beliefs, while ordinarily positive people may become cynical. Sensory input can trigger adverse reactions in both adults and children. Certain sights, sounds, smells, or tastes can bring back the emotions of a traumatic event. Even the tactile feeling of something can trigger these emotions. Because sensory input is directly connected to our experiences, our senses can also help us with stress reduction, as we will discuss later in this training. It is also important for us to understand that certain disaster or crisis situations and circumstances may provoke a stronger stress reaction. The human response to traumatic events is heightened further when the event is unexpected, when many people die, especially children, when the event lasts a long time, when the cause of the event is unknown, when the event is poignant or meaningful, or when the area impacted is large.